Hi guys, in this video I want to talk about PCOD and what are its symptoms. So PCOD is a very common condition, probably 6 out of every 10 women, especially even younger girls are getting detected with this condition, and most of females come with either one symptom. So we call it PCOD, which is Polycystic Ovarian Disease. In case if you're seeing multiple symptoms, then we call it a syndrome. And syndrome is basically not a disease, it's collection of symptoms which probably is a disorder. That means something is not in order. So let's understand. So if you have PCOD, what you can do to reverse this out. Number one, remember that whatever are the symptoms that you're getting for increased male hormone like testosterone, or if you have hyperandrogenism, which is where your androgens are getting elevated, then that is happening because of high level of insulin. When you have high level of insulin, there is a condition which is getting developed in your body. It's called insulin resistance. That means you will go and get yourself tested. You might see a higher increase in your blood sugar levels, or you might also, if in case you go for insulin test, your insulin levels will be elevated. So in case if you want to work on reversing your PCOD condition, you have to first work on improving your insulin resistance. So with a lot of patients we have worked with, especially who have PCOD, we have seen that intermittent fasting and getting onto a low carb diet has really helped people. So why does that help? Because if the moment you go on low carb diet, it stops triggering your insulin, and in return it tries to balance your hormone. And once your hormone cycle improves, you also see results in getting your period cycle normal. In fact, the second thing that I would suggest with anybody who has PCOD is to start on seed cycle. To know seed cycle, I've given a link in the description what are the combination of seeds you can take based on your cycle, and you can follow that up for repeatedly for 2 to 3 cycles, and you will start seeing that if you don't have regular periods, your periods will become regular. What are the symptoms that most PCOD female come up with? And in fact, most PCOD patients these days know that they have this condition. So they will either come with irregular or heavy flow periods. Number 2, there will be excessive hair growth around their face, around their chest. That's what we call hirsutism. Then there will be thinning of hair, there will be a lot of hair fall, and with that, female can also come up with problems like acne. Later on, when this problem, if we don't take any treatment, then it can also lead to infertility.